Spectacle lenses, atropine or contact lenses, whatever the myopia treatment, it's only effective if the patient and the parents are on board. Successful myopia control begins with the patients and parents buy-in, and that comes from a clear understanding of the disease and its treatment. Hi, I'm Dr. Ramesh Kekunaya, and I'm here to explore the importance of myopia education in myopia management. We will cover the strategies for communicating treatment options, improving adherence to the therapy, and ultimately enhancing the patient's quality of life. Many of the parents think that there are no options for myopia treatment. At the same time, they think all types of myopia can be treated. So when you treat myopia progression, it's only the axial myopia progression has multiple treatment options. So it's very, very important to educate them, make sure that they don't have any misconceptions about this treatment. Parents, when you put 100 things together, they will get confused. So I usually start with what is basic. When myopia is progressing, your eyeball length keeps on increasing. For example, the child's power is -1. I'll ask, okay, do you want your child to go into -6 or -7 in the next 10 years? Or do you want to arrest it at maybe -3 or 50%? Prevention can we do? Whenever you start with these treatment options, what we do is reduce the length of the eyeball growing. If you look at the myopia progression stoppage or arrest, has probably 16 to 18 permutations and combinations. So I discussed with the parents what is the customized approach. For example, if the child has a peripheral hyperopia, that child needs defocus glasses. If the child has pure axial, probably pharmacological treatment is better. And also, something I would discuss with the parents is the cost. Because in the long term, sometimes the cost of the glasses could be very expensive, where we are practicing in different parts of the world. So we need to strategize what is best for that child. And sometimes parents come with the 3-year-old or 4-year-old child. That time, sometimes optical correction is the best way to begin with, because the child may not be able to put the drops, and sometimes safety and efficacy of these drops are not really researched in patients who are very, very young. So if you look at, for example, in India, the eye drops are very cheap, even if it is used for a very long term. The optical becomes less. But if somebody has a very high risk, we might have to start with the combination. So when they can't afford, then your treatment options becomes limited. You need to really think about case-to-case basis, then offer the treatment. Because if you look at the different treatment options, the success rate in controlling myopia is somewhere around 50 to 60% of all of these modalities. So we can really customize these options depending upon the cost. And I always emphasize to the parents that this is not a 6 months old therapy. It's going to go on for maybe 4 years, 5 years, or 7 years. So this discussion is very, very important. It's a long-term treatment. First thing, I'll have a discussion with the child. I ask them, what do you want to become when you grow up? They will tell, maybe I want to become an army person or pilot or a doctor. Many of them say. But I tell them, do you want this power to go up, or you want it to be stabilized? And for the parents, I tell them 2-3 things. Number one, at 20 years, you have different refractive surgery options to remove the glasses. If you want to go for refractive surgery, -1 or -2 glasses power is better than -6 or -8. So this is one thing you can control the progression. The refractive surgery later becomes easier. And then there are complications related to cataract. They have a high risk of developing glaucoma in later part of their life. They may have some retinal complications. So to reduce this, if you adhere to these treatment options, we can not eliminate, but at least we can reduce the risk of developing complications. So this builds trust in parents as well as patients. Treatment adherence is very important because many people think that once you give these treatment options of spectacles, contact lenses, or drops, they think everything else is, excused. For example, behavior therapy, reducing the screen time and increasing the outdoor activities is very important. They cannot replace each other. This is where I work with with the children than with the parents. Make sure that the child understands what I am doing, why I am doing. I tell them, what is your screen time? I ask them, what are your activities? Okay, continue these activities. Can you do outdoors rather than doing it indoors? That's number one. And for the parents also, I encourage not to use a lot of screen time. Go with them outdoors, maybe even if it is 1 hour, depending upon the place where you are, you can continue it. So this is, I work with both of them to make sure that they work together, because children usually look at their parents and then follow. One thing I do is, when they come for follow-up, we measure their eyeball growth, right? Length of the eyeball. We show the graph. Hey, we started this treatment. Now the graph is plateauing, or it can be on the other side, it can be increasing. So when you show that, they become a little bit guilt will be there, and then they adhere to this, and it becomes easier to motivate them and remove those barriers. Yeah, there are lots of digital tools. For example, for the parents, there is something like Myopia calculator, which is a simple thing, 5 or 6 questions we have to add. Okay, if both the parents are myopic, what age they started, what's the age of the child, what is the screen time of the child. Depending upon that, this myopia calculator will tell whether the child is at risk, mild risk, moderate risk, or severe risk. World Society of Pediatric Ophthalmology and Strabismus has come up with the consensus guidelines. Parents can use it, and even the healthcare provider can use it. What works best? Because when you have so many options, what works best for that child, these consensus guidelines will help.